So good evening, everyone. I am super excited this evening to introduce you to welcome you to our first of our 5 survivorship series. And the title of tonight's lecture is Who Am I Now? We'll be talking a little bit about identity and goals and all that good stuff that happens after you're done with your cancer treatment. Tonight's speaker is Dr. Brian Leitzke. He practices health psychology at University Hospital and American Family Children's Hospital. He specializes in psycho-oncology, pediatric psychology, chronic and terminal illness, trauma, geropsychology, psychology, grief, and palliative care. Wow, that's a lot. He earned his doctorate in clinical psychology from the UW-Madison, yay Bucky, and completed his postdoctoral fellowship in health psychology at the UW hospitals and clinics. Dr. Leitzke is a registered is listed in the National Register of Health Service Providers and Psychology and is licensed in the state of Wisconsin. So just the who's who of who's here tonight. And he also is one of the folks that we have shoulder tapped a couple of times, and this is the first time we've successfully been able to connect to each other. So that's really wonderful. So I welcome Dr. Leitzke and welcome all of our participants tonight. And so with that, I will turn it over to you and mute myself.
Thank you for that wonderful introduction, Kirsten. Are you able to allow me to share my screen?
You bet, you're all set.
Perfect, already on it. All right. I'm assuming everybody can see my slide. We have my intro slide there, it's great. Yes, Kirsten, thank you so much. It's been a long time and I was always happy to help and really hoping to be able to connect with you at some point. Tonight's talk, I understand, is the beginning of this survivorship series. And you know, as a psychologist, I work with a lot of people on at various stages of their cancer course, from early diagnosis through treatment and on into remission and then what we call survivorship. And much of the work that we do is one-on-one. And what I was hoping in this talk to do was be able to pull some of those things out, not so you all and I can do one-on-one therapy here, but to kind of give you an idea of some of the conversations that are had, some of the things that that we work on. And honestly, the idea here is not to push you guys all into therapy. The idea is really to start some conversations. And for some of this stuff may be very familiar, and other things just some prompts and ideas to discuss with family and friends, to contemplate on your own, to journal about as you may be figuring out your own identity, where you are right now, regardless of how far into this you might be. So right now we're looking at this question of who am I now? Life after cancer treatment, life after we, I guess, decide to move back into our regular life, right? Trying to get back to normal, whatever that might be. Kirsten gave me a fantastic introduction, so I can skip that. I did want to, before we get started, thank her. Huge thanks for getting this going. Our wonderful program director at Gilda's Club for facilitating this series, getting me here, and then all of the other fantastic programming and resources. She's just been absolutely wonderful. So thank you, Kirsten.
You were too kind.
So who am I now? As all of you know, and we'll talk a lot more about it, cancer can lead to a lot of changes. And among many of these changes that we see is this, I think, profound shaking of our identity, something that I know that many of you are familiar with. And no matter the treatment course, no matter the prognosis, things change, things are different. And regardless of how you feel about it, whether you feel scared, whether you feel optimistic, it's a huge challenge to figure out how you're going to best move forward. So today I'm hoping to talk a little bit about how we reconcile identities from before versus after cancer. So I want to first talk a little bit about how cancer might impact the way that you see yourself, how you all might identify in the world. I want to talk a little bit about how cancer not only changes the way that we might identify ourselves, but also how it fundamentally changes our identity and makes it challenging to integrate it into whatever identities we discover as we move forward. And then also how some of our identities, I'm using that word a ton, and so we're going to keep doing it throughout here, how our identities can lead us to re-examine priorities, change perspectives, and particularly as you seek some sort of meaning and purpose, which many do as they're trying to figure out how to move forward. So cancer and identity. How does cancer change who you were? There's a lot of things that form our identities. Our identities are formed from personality traits. Some of us might consider ourselves to be a little bit quirky or energetic, outgoing, quiet, laid back, all sorts of descriptor words we can use to describe our personality. We all find ways to do this throughout our life. It changes, it evolves. Our beliefs, spiritual beliefs, religious, political, how we see the world are other ways that we think about and perceive and describe ourselves. Our qualities, are you tall, short, dark-haired, blonde, athletic? Are you a procrastinator? These different qualities help define us, or at least the way that we might define ourselves. Our occupations, many of us are defined by our job. What do you do for a living? This is often the first thing people ask you when you meet someone is, what do you do for work? Commonly, this is something that if we don't identify ourselves that way, other people try to. Our roles that we play in life. This is often a question of, who are you? Are you a mom? Are you a dad? Are you a bartender, an accountant? Are you a driver? What do you do in life outside of your job? These are many of the ways that people find, people try to identify themselves, or people at least maybe perceive other people identify them. And throughout our life, we have experiences that help shape this. From childhood into school, we have all sorts of things and people and experiences that help shape our identity. Our family and friends, trips, when we go through trauma, adolescence, I think those last two are kind of redundant. Independence, as we get into early adulthood, the jobs we pick, the partners we find, different crises. We experience births and deaths throughout our lives within our family, and then of course our health. And along all of this, we mature, we develop, and we grow in a number of ways, physically, emotionally, intellectually, all of which further shapes who we are. And so we have this constellation of experiences and traits, beliefs, roles that all shape our identity as we move through the world, as we move through childhood, adolescence, into adulthood. And there are occasions in life where something happens that not so subtly shapes us like many of our experiences, but dramatically impacts how we see ourselves and how we go about our lives. And a cancer diagnosis is one of those things. A cancer diagnosis, when it hits, will often stop us abruptly in our tracks. It leads to a number of different emotions. People can feel shocked and surprised, fearful, confused, angry, anxious. It can turn inward to guilt and shame. There's so many things that come along with this diagnosis, and oftentimes we are, at least day of or overnight, asked to change our life. We have to pull things together and we have to pivot and move in a different direction to deal with this new thing. And it now becomes consuming. And now we have to move into treatment. And as you go through treatment, all those emotional changes continue. The fear and the uncertainty. And now we have to deal with what treatment actually does to us, to our body. Pain and fatigue and disfigurement, what it does to our cognition, our thinking. Chemotherapy and radiation, surgeries all last in long-lasting, if not permanent, changes in, ideally in an effort to rid us of cancer, but ultimately it causes significant changes. And treatment can last for weeks, if you're really lucky, months, years. And we can do this over and over, and it takes a significant toll on your body and on the way that you look at your life. And if we're lucky, we can get to remission, which for some brings relief, and for others more fear and more uncertainty. For some people, it might be a time to celebrate a really long, hard fight, knowing that you're now cancer-free. But for others, fear of recurrence, you just can't let your guard down. And so this is another phase where we're off the beaten path. We're off where we were. We're off where we're going. And so while remission might allow some people to resume their lives and get back to what they were doing, others, whether early on or later, might find themselves navigating a recurrence. And a recurrence can be like going through diagnosis all over again. And we can go back on that track. It might shift us into a whole different place of fear. There's exhaustion, and there's this anticipation of going back into treatment. And I think for some, knowing what you might be going back into can bring some level of comfort, while for others, they know exactly what they're getting back into, and it does not bring that comfort. And so we go through the cycle again. Ultimately, the hope is that at some point we get to this stage of remission where, whether it's your first or second time or third time through or more, you're told that you can move forward from treatment. It allows you a chance to try to get back a life that you had before your initial diagnosis. And so we're back on this track. And this is often a time where many people try to take stock of what happened. They try to figure out what happened, what they went through, where they came from, and where they're going to go next. And this can lead to a lot of different thoughts and worries. Is it going to come back? Are we done? Are we really done? Or is this coming back? And if it is, when is it going to come back? And where is it going to come back? What happens next? Now that you're done with all of the triaging and trauma that went with everything, now there's what? Nothing? Maybe some checkups, but do we still have that safety net where we are with our medical providers all the time? We had appointments to check in on things, or are we just kind of on our own now? Can you do some of the things that you used to do? Do you have to find something different to do? And even if it is the same, are you the same? These questions make it really difficult to try to re-engage, whether it's back with our jobs or back with hobbies, friends, family, socializing, all of these things. These questions pop up. They make it hard to get back into that. Do you look the way that you did before? When you're going through treatments and you're actively doing that, maybe it's a little easier to accept some changes. But what about when you're trying to get back into your daily life and you're trying to get back with friends and family and jobs and getting back out there? This changes you. Can you do what you used to do? What if you physically can't? Can you return to your job? Can you engage in all the things you used to enjoy? Can you take care of the yard? Can you exercise? Can you play with the kids? All of this requires physical strength. It requires cognitive abilities that may or may not be at the same place as they were before. You might have a realization that things are just really different and that you're not quite the same person that you were before you started all this. Inside, there's a piece of you, it's still you, you're still there, but something else has changed, which can make it really difficult to navigate what's coming up next. And when there's a shift in priorities and perspective, sometimes having something that so dramatically impacts your daily life makes you take stock and reflect and decide, you know what, some of those things that I was doing before just wasn't not as important as I thought it was. Oftentimes people are working a lot and they're like, you know what, I'm just not spending enough time with my friends and family. There's a lot of things that can be changed, this perspective. All of this adds up to this question of, who am I now? And to explore that question, it sometimes helps to try to go back first. Go back to try to find who you were before. So it's the first question, and I'll have some of you think about is, who were you? Were you active and physically strong? Were you identified by your job? Did you dig in? Were you the boss? Were you the one who was always there on time, who was making sure everything got done right? Were you dependable? Were you reliable? Were you a mom, a dad? Were you a caring child? Exercise and physical fitness, was that something that was really important to you? Your looks? All of these things are aspects of our lives that we navigate at some point. We place some sort of worth and some sort of value on them. And depending on where we are in our life, some of these become really high. So who were you? I think there's a lot of ways that we can label and define ourselves, and looking at where where you were and who you were can help form the basis for who you might be moving forward. So did you define yourself by labels like mom, dad, or friend, your job? Were you an early bird or a night owl? Were you smart? Were you the expert at everything? Did you like to cook? Who were you? What are the things that really drove you and made you get up every day and made you want to engage with your friends and your family? And if you can kind of get an idea, maybe remember back to who you were and some of the ways that you used to go about the world in your life, what changed? I think, as you know, a lot changed. Chemotherapy, radiation surgery, hormone therapies, they all bring out a number of changes. And even simply going through them can change your perspective of the world and the medical system. And they often have long-lasting effects on how we view ourselves. And of course, there's considerable physical consequences to many of these things, all in that effort to get rid of cancer. So what changed? It's physical changes, a lot of them. For some, we might have considerable fatigue. Some of these changes, this muscle loss and weakness, some of them might be short-term. Maybe in a little while, you can get those back with a lot of rehab. Maybe some of you are rehabbing that right now. Maybe some of these are permanent. Some of these are going to be with you, and maybe some of them are things you need to learn to navigate indefinitely. Some of these changes might be very obvious and apparent not only to you, but to those that you interact with, your family and friends and colleagues and anybody else that you go out in public with. It might be very obvious. Some of these things are a little more hidden from sight that are really only apparent to you, maybe those close to you. Fatigue is often one of those really big barriers that people don't see. People don't understand. They see that maybe you're not doing the same things that you used to do, but they don't really know why. Psychological changes. Beyond those physical changes, we have tons of psychological changes, from the initial diagnosis with sadness and shock and anger, anxiety, fear about the future. There's anxiety that gets added into medical procedures and pain. PTSD-like symptoms from traumatic procedures. Anger is very common. Guilt and blame, I mentioned that earlier too, how sometimes people have a tendency to take some of that inward. The social changes. Going through cancer treatment after diagnosis, a weakened immune system, weakness and debilitation. Many people are forced to leave jobs and isolate themselves from friends and family, avoid social outings, drop hobbies. People might not quite understand, and it might be too exhausting to try to explain. Now you have medical appointments all the time, and so communication is difficult. You're focused on treatment, and then for some of you, even if you're not so busy, especially as you move forward, now everybody else seems busy. And so sometimes you can feel abandoned or forgotten. We also know that cancer doesn't happen in a vacuum. It's not just happening to one person. It's the physical toll of it is happening to one person. The treatment is directed at one person, but those close are also usually impacted. And so we have an impact on other people near us. And now you have to look at potentially navigating their emotions, the things that they're going through. Not that it wasn't hard enough to deal with what you're already going through. And so with or without some of the changes, people find themselves, I mentioned reduced medical support here. And I think I mentioned that earlier, is now all of a sudden you don't have that same safety net, and you don't have all that activity and the trauma and going through, you don't have all of this that you're moving towards. And so what happens if something comes up? Do you get a little more in tune with your physical symptoms? A little more fear? You had so much support you probably didn't want, but now all of a sudden you don't have enough. So what changed? A lot changed. And so after all these changes, it's quite common to ask, who am I now? It's also common to focus on these changes. It's easy to see when you compare yourself now to where you were before, you can see what's different, all the things that you can't do. Cancer is not something that usually gives you new abilities or superpowers. So usually our focus is on what it took away. And as we think about what it took away, it gets hard to think about how we can move forward in any meaningful way. So here it can be helpful to try to take time to see maybe what still remains as part of the exercise of looking back. So to find out what still remains, to try to reconcile yourself before and after cancer, We need to find a way to integrate those things, analyze what it is that makes us who we are, and how that might fit with a new reality. So we often identify ourselves based on those things that we mentioned before, the way that you perceive ourselves or the way that others perceive us. But if you dig a little deeper and really explore some of those things that you identify by, you can usually find that there's a little bit more to it. So when you ask the question, who was I? Instead of focusing so much on the things that you can't do that might have made who you are, we can look a little bit into what these things are. So as a parent, you're a mother or a father, but now fatigue, pain, debilitation, other things, I can't pick up my child. I can't get on the floor and play with them like I used to. I'm not in the kitchen making meals, and I'm not a provider in the way that I was before. If you're defined by your job and you can't do that anymore, then where do you find your meaning, your purpose, your reason to get up every day? If you're an athlete, if that was something that you really valued and you can't do that, you can see the change. You can see how these things have been changed from before and after. And it feels like you won't be able to do any of these things again, or maybe for some of you, it's just a really long ways off and you're not sure what you're going to do until then. So what does it really mean to do these things, to be these things? Instead of looking at what you feel like you can't do, can we look at what it means to be these things in the first place? So what does it mean to be a parent? We usually think of love and caring. That's what it means to be a parent. You support, you provide. Loving and caring is not just playing on the floor. There's a lot of ways to do that. And I don't think we necessarily drive kids to practice and to school and all these events because we like doing that. I think we can all avoid being in the car for a little while. We can avoid the car drop-offs. We can get rid of all of that. That's not why we're doing it. We're doing it because we provide, we care, we love, and we want to support. For those of you who might be really defined by your job, what does that mean? Are you reliable, dependable? You enjoy the hard work. You find meaning in the outcomes. You find meaning in the work that you do. It's not necessarily the tasks. Many people are working with people that they don't like. Many people are pushing papers. Many people are delivery drivers. It's not the act of what you're doing that usually you find valuable. There's a meaning to it. There's a value to it that I think drives people. An athlete, you want to be strong. There are values associated with this too. You value movement. You care for your body. Hobbyist, I mean, whatever hobbies people might be, if it's carpentry or knitting or making beer or whatever that might be. There's curiosity involved with this, passion. You enjoy hard work and really getting deep into an issue. Maybe there's community involved with it. Being able to enjoy some of these things with friends and family. Are you a good friend? Is that a strong value? Is that someone who you thought you were? What does that mean? Having fun, supporting others, those bonds and the camaraderie. Advocacy is often a common thing. People look for causes and passions. What does that mean to be an advocate? So there's a difference between what we do in these roles versus what they mean to us at our core. And so as we think about the values that shape our roles, that process can help bridge the gap between who we were and then who we are now, despite whatever limitations might be in the way. And so here I'm looking at values. Values are the things that help form our identities, those roles that we have. So thinking about values and the things that mean the most to us, the things that we hold close to us, hold dear, that we strive to live by, that maybe our parents instilled in us, the things that we're hoping to teach our children, some of the values that drive our decisions. Now, there's a long list of values. I assume it's infinite. And for this group, I certainly can't capture every single value that all of you might have. But as a list of some things just to think about, how do these values, what is it that defines your life? What are the things that you have found really important? Are you someone who really values loving and caring and supporting other people? Are you outgoing and adventurous? Do you enjoy being funny and personable? Is hard work and dedication, dependability and reliability important? These are fundamental values that I think we don't always think about on a day-to-day basis, but often underlie how we interact with others, how we make decisions, and how we just generally go about our lives. So when we ask what changed, did your values change? Did something about going through your diagnosis and treatment and coming out the other side of that, did something about that change your values? Or is it just that maybe you don't know how to live by them in the same way? There's a difference between, as I said, doing things versus actually understanding why you do them in the first place. So if you can't do them in the same way, can you incorporate them into your life somehow? How do you learn to be flexible and maybe redefine what it means to live a life that's consistent with some of these values? Can you identify the values that make things important to you, still apply them to your life? When you think about all the stuff that you can't do, what is it about those things? Why is it so difficult to let go of something? What's the value there? What's the thing that's important in driving you? And so that flexibility, can you find a way to still hold them close and live a life consistent with values despite limitations that might be getting in the way? And this is, I don't know how many are on this page, but there are hundreds and hundreds of these descriptive words, and there are some that probably some of you might be already popping up in your minds of things that are valuable to you, core values that you may have learned somewhere through your life. And so I want each of you to think about some of those things and hold on to them and see how they apply to your life today. Even looking back day to day, not even globally, like across a year, but today. Did you do things that were consistent with your values? Or were there things that you feel you missed? Why is that? Don't get me wrong, we're not all perfect. We can't just make this list of values and then all of a sudden all live every day perfectly consistent with this. That's not going to happen. I have values that are very close to me, but I certainly can't check every box every day. And so we prioritize. And that process is important too. How are you prioritizing your values? Are there ones that maybe you do want to check off at the end of every day before you go to bed as you think back about what you did? Are there ones you want to make sure that you checked off? You show some love and support for your family. Not thinking about necessarily what it looked like, but did you do it? I think we also know that however you decide to do this, it's not like it was. Being physically active, if that was something that was valuable to you, was pretty easy when you didn't have physical limitations keeping you from getting up, when you could just go to the gym, when you could go for a run. It seems so simple to play with your kids or play with your grandkids, but not when you can't sit on the floor for very long, if at all, when the fatigue gets in the way. So the way that you approach some of these things that you find valuable, whether you enjoy doing housework or you identify with your job, these things might look different, but just because it looks different or is at a different pace doesn't mean that you're not fulfilling some of the same values. In conversations about values, I was working with a woman with lymphoma who, after a couple of recurrences, was really struggling because she lost her job. She couldn't continue her work. And so she, as one big thing that she identified with, she wasn't able to do that. She's very physically active. And now, because of fatigue and pain, she rarely exercises, going for even short walks outside in the hallway of her apartment. It's very, very difficult. And she enjoys her grandchildren. She values spending time with them, but they're small. They play with toys on the ground and she can't sit on the ground. And so she doesn't do physical therapy because she's never going to get back to the same place that she was. So what's the point in trying to exercise and work out and get strong if it's not possible to get back to where she was? Through exploring some of her values, she learned that, well, maybe I can't get back to where I was, but maybe if I can re-engage in physical therapy, I can learn some of the things that I need to be able to sit on the ground for a little while. One of her struggles was sitting down and then getting back up. She wasn't strong enough. So what if instead of going to physical therapy to try to just generally get stronger, what if you go to physical therapy specifically to learn to sit down and get back up again? And so through that, she was able to, on the one hand, start engaging again physically, which she found valuable. No, it wasn't the same high intensity interval training that she used to do. But she's focused, working with PT regularly, and mission focused, not just to get stronger, not just generally to get more fit, but to do very specific things. So she can sit down and she can spend some time with her grandchildren. And so now she has both values that she's working towards. It's a long process. But these are things that are important to her. And she was able to, just by exploring and shifting values a little bit, find a way to do some things that she wasn't able to do before. Another man with colon cancer really enjoyed fishing. It's what he spent most of his summers doing. He loved going fishing. He'd go out on the boat, he'd take his son, he'd take his friends, and he would go fishing. But with an ostomy and pretty terrible weakness, going out on the boat fishing isn't an option anymore. Can't really tolerate it anyway. He also has numbness in his hands, so dressing the lure and fixing his lines is just something that he doesn't really have the dexterity to do. But his family, knowing that this is important to him, agreed that, well, maybe we can find a place that's not on the boat. What if we were able to find a nice place on the shore where you can go fishing and we can help you with the pole, help you with the lures? Because what he really wanted was to spend time with his family fishing on the water. So how do you do that given the limitations? Another individual I worked with is a police detective with breast cancer who was not able to handle the daily physical toll of her work. So instead of going back into work, what she does is she calls her partner and she calls her colleagues regularly, especially when she sees high profile things in the news. Big events that, maybe some of us, we see as scary, but she knows that her partner and her colleagues have to go in and deal with that, and it's going to be traumatic. So she calls them and she gets information about it. They still allow her to do that, and she gives them support. She's involved. She's doing the best she can to be part of the team, to be involved in the work in some way, even though it's not like it used to be. I know these sound a little bit just like accommodations. We're just accommodating for all of these issues so we can try to do the things that maybe we did before. But it's more than that. It's about finding ways to do the things that you enjoy doing, to live your life as full as possible despite the limitations. And finding the commonality between the things that you really enjoyed doing previously and those same things now. What are the things that you enjoy? What are the things that you find valuable? So it's not just accommodations, even though that's might be what is needed. But it's about trying to figure out how to live life, a valued-based life, as you were before, but maybe a little more intentionally, because it takes a lot more effort now. So given all of these experiences that you've had, either physically, psychologically, or socially, things are of course different. And while you might not be able to do all of the same things you used to, you can still live that life that is aligned with values that you held close to you before. But that's not always easy to do. The changes are not always acceptable to us. And acceptance is a really important piece of trying to make changes. And by acceptance, that doesn't mean you have to like any of this. Acceptance doesn't mean that you don't want things to be different. Not at all. Acceptance means finding a way to acknowledge that this is the way that it is right now. Simple recognition of the truth that this is the way things are in this moment. So what does it look like to gain some level of acceptance over the changes that you did not want, that you did not ask for? So you can be present in whatever the current moment is and build on that and move forward in a meaningful way. It's hard to do. And I think in an attempt to gain some level of acceptance, it's also important to extend yourself some compassion. If you had a friend or a family member who came to you and said that they couldn't help you around the house, they couldn't help you garden, they couldn't help you move because they recently had cancer treatment and they don't have the strength and they're too fatigued, so they can't help you today. Would you think of them as not a good friend? Would you think of them as unmotivated or lazy? Now you have a unique experience and a perspective, so you probably understand where it's coming from, and you would definitely give them that latitude. But I wonder if you all give yourself the same latitude. When you think about the things that you can't do anymore, when you think about the things that have changed, do you give yourself the same compassion that you would give somebody else? Or are you a little hard on yourself, feeling like you should do more, even though you'd never hold somebody else to that same standard? It's hard to extend ourselves that kind of compassion. It's very difficult. But it does ourselves, I think, a great disservice when we don't. And it doesn't give us the same opportunities to be able to do things that we might allow others. So being kind to yourself, just like you would anybody else, gives you that opportunity to reframe your situation and hold yourself, well, not to the same standards as before, because you know they're clearly not reasonable, but to new standards given the situation. So it's looking at ourselves through that same lens that we would look at another person in the same situation. It gives us space, it gives us flexibility. And that's what we need in order to be accepting of this present moment the way that it is right now, and then build on it accordingly. So how cancer changes who we were, there's certain questions that you can go through to try to explore those changes and what they really mean so you can move forward. Who was I? What changed? What are the values that shape my identity in the first place? And how can I live by some of those values now despite the changes that I've endured and the physical cognitive limitations that I might be experiencing? And can I show myself some compassion to allow for this acceptance to be able to build and move forward? But beyond examining how our identities have changed just because of cancer, we also want to look at what role cancer specifically has, and how it plays into our lives. So we're talking about what it's done and how many of you have to change your identities and change what you do because of what happened. But cancer was still there. How does it integrate into your life? And so we talked about how it looks different, but how cancer fits in also plays an important role. And regardless of how you feel about what's happened to you now or in the past, or how you feel about what might happen in the future, cancer is in some way part of your life. And so there's a few specific ways that that psychological researchers and cancer researchers have looked into identities, and how people find a way to identify themselves during and after cancer. And I understand that not everyone identifies perfectly with the categories that I'm going to talk about, but they sometimes provide a little bit of a context of how cancer does or can be integrated into identity. Some different types of identity emerge really organically or naturally through the context of diagnosis and treatment. Um, and some are actually pretty important on how people gain a certain outlook as they move into survivorship. And each of them come with some implications about coping, some more adaptive and some more maladaptive, depending on the situation. One identity that some people take is that of a patient. With so many medical appointments and tests and procedures, and treatments, and phone calls, Zoom appointments, medications, hospitalizations, it's hard not to just feel like a patient sometimes. Many people will consider themselves professional patients. I hear that all the time, is that they're a professional patient given the amount of time and energy and effort that they put into managing their medical condition. It's often equal to or more than what they did in their regular jobs beforehand. So they're now professional patients. I have not yet heard anybody get paid for that yet. But even after cancer, one might still identify as a patient, even though they're not going to all those appointments in the same way. Even though the treatment doesn't look the same way, they might still identify that way. In some ways, it can be protective. Identifying as a patient can allow you to navigate medical appointments differently. Sometimes you can feel a level of acceptance and being integrated into the medical system because you're part of it, you're a patient. This is what you do. As something comes up, you're a patient. Getting poked and prodded, well, I'm a patient. That's what happens. Losing some dignity and privacy, well, that's okay. I'm a patient. Patients don't get that. Outside the hospital, when I'm not a patient, then I can have that. But not when I'm a patient. And so being a patient can sometimes allow an acceptance of some of the things that you still have to go through or may have to go through in the future. But it can also lead to a greater sensitivity of the changes in your health. Sometimes being a patient can mean greater fear of recurrence or some other negative outcomes that might be down the road. Being a patient makes you a little more in tune with some of these things, because as a good patient, you have to report it. You have to make sure that you talk about it. You have to make sure your doctors know about it. And so you tend to be hypersensitive and in tune with some of these things. So depending on the situation and the context, being a patient can be very protective and adaptive, or potentially make you a little more sensitive to some of your health changes, which can add to some fear. Another identity some people take on is a person with cancer. It might be easy to see you might be able to see at least how your previous life fits into your life following cancer, but it's not always, or it can, at least it's not always easy to see how you could just be a person with cancer, right? So you may not feel like a mom or a dad or a brother or whatever you do for work, whatever you used to do for work, but now you're a person with cancer. It becomes all consuming. This is now who you are. This is how either you see yourself, or maybe this is how you think other people see you. This is the first thing that comes up when people ask, what do you do? Maybe this is the first thing you think of. You feel that this is the way that you engage. These are the things maybe you talk about. Going through cancer is a huge event in your life, so it's understandable that you talk about this with friends and family. Sometimes maybe it feels like it's all you talk about. Now, in some ways, this kind of identity, being a person with cancer, can allow for an integration of cancer and that experience into your life. For some, it guides them towards supporting others, advocacy. It allows some people to be more transparent, to not feel embarrassment or shame around going through it, because this gets integrated into your identity. It's part of who you are. But wearing that on your sleeve every day, being a person with cancer, can also be exhausting. It can also mean that it subsumes your other identities. It doesn't allow those other things about you to shine through the way that they may have before. Are you a mom or a grandmother, or are you a person with cancer? As a point of this series itself, another identity many people take on is that of a survivor. Sometimes we're given that identity, survivor. Now, it's true, anybody who goes through this is a survivor, but it means something different to everyone. And viewing yourself as a survivor, it could imply that you survived something. You were attacked, you fought, you won. It's behind you, you survived. You may want to help and support others because you survived, you know what it's like. And so you want to be able to provide that level of support and help to other people. Maybe like a Purple Heart, you wear it like a badge of honor and you don't forget because you're a survivor. Being a survivor can bring a level of control and accomplishment and hope for everything that you went through. It also might mean a little bit of an avoidance of maybe revealing physical symptoms as they come up. If you're considering recurrence, you're a survivor, which means that's not supposed to happen. If you're suffering, how do you reconcile feeling terrible and fatigued and in pain with being a survivor who, even as in this picture, is out and walking and engaging and social? So a survivor sometimes has a harder time disclosing when maybe they're not feeling that great. Sometimes being a survivor can, similar to a person with cancer, create an over-identification with cancer. And if that's not something that you want to be your identifying feature, sometimes people can have a little bit of a difficult time taking on that label. Some might feel that being a survivor implies that you do have control. You took the initiative, you took the effort, you fought. Some might feel that survival is up to luck and you didn't have a lot of say in that. A victim is another way that some people identify. And a victim didn't do anything to deserve cancer, but it happened. And it happened to you. The diagnosis and the treatment and all of the changes that we've been talking about, it hit you unaware, but you endured and you survived. But you're a victim of something terrible. Nobody's going to disagree with that. Being a victim might allow you to feel that it's not your fault. It allows you to see it as something that was not due to your choices. There's nothing you could do about it, even if you wanted to. This happened to you. But as a result, it can also make you feel hopeless, maybe even useless and fearful because there's nothing you can do. So you're very vulnerable. In the same way that you were vulnerable to cancer in the first place might make you vulnerable to recurrence. And so you can see through some of these that there are different ways that the way that you identify can be useful or potentially harmful as you work to integrate your various experiences with and without cancer into who you are now. And certainly there's controversy around some of these. There are very strong opinions about some of these labels. Absolutely. Some people are very easily can adopt one of these, and it resonates with them, and they feel it very much describes their experience. Some carry more than one of these. You don't have to just choose one. Some switch between them. This might change a little bit after going through cancer and then going through a recurrence. Some people might reject all of these. And I'm here to say there's not a right way to do it. You can create your own labels, or you can avoid using labels altogether. Sometimes labels themselves are not very helpful, and there's no point in trying to categorize or put yourself into a box when your experiences are different than others. But I do believe that being thoughtful about how you integrate your experiences and consider their roles in your life can allow you to have a sense of control over your perspective. It allows you the opportunity to not let labels, thoughts and feelings that might be unaware to you dictate who you are, and also dictate how you might move forward. So being thoughtful of what some of these might mean to you, what your experience has meant to you as you move forward, can help you take some control over that perspective. So lastly, I wanted to talk a little bit about moving forward from this. What does it all mean, and where do you find purpose? One thing that many people experience, and I mentioned this earlier too, after a cancer diagnosis, is a change in perspective. It can hit hard and it can hit quick, and it can make you take stock of your life and the things that you're doing, the things that you focus on, and change the way that you perceive it and shape your perspective. It can shift or realign priorities very quickly. Family and friends may take on a much greater importance. Maybe work takes a back seat. For some, ensuring strong healthcare coverage and financial stability becomes much more important, either because what you've experienced made it very difficult, or you at least got a glimpse into what could happen without some of those supports. And so now all of a sudden that maybe takes a front seat as you're trying to navigate a post-treatment world. Looking at these identities, you can see how they may find different purpose. The patient may be focusing a little bit more on their next medical appointments and ensuring their basic medical and health needs, avoiding unnecessary risk, knowing how fragile life can be, prioritizing and making sure they're doing the things that are going to keep them safe, keep their loved ones safe, so they can move forward as best and healthy as they can. Someone who identifies as a person with cancer may be ready to use their experience, talk about that experience, and advocate for others, provide others the support that maybe they had, or maybe the support that they wish that they had. They put time and effort and money into causes and research to fight cancer, to promote awareness to friends and family and society. There's a lot of purpose that can be taken from that identification. A survivor might look at it a little bit differently. A survivor might be more ready to re-engage with life, to take advantage of whatever time they have left, be it long, be it short. As a survivor, you may wear that as a badge of honor, but you also might want to just put it in the past, not let it dictate your life, because you know what you went through. And so you want to be able to take advantage of whatever you can. A victim may want to forget cancer ever happened. It might not be something that they want to dwell on. Maybe it leads to a greater fear of recurrence. Maybe there's some hopelessness, sometimes futility, or even just resignation. Cancer can sometimes feel out of control. And ultimately, it might just lead that desire to move it on, leave it behind, so you can live your life. The changes in perspective can help shape the meaning that you take out of all of your experiences. And it provides a sense of purpose moving forward. So do you want to focus time on friends and family? Do you feel that there's things that you never did before that you want to do now? Providing support and advocacy for others might be something that becomes really important to you. Or maybe it's just trying to enjoy simple pleasures in a safe space with the people that you love. But thinking about those priorities and how things may have shifted can also give you purpose. I'm assuming these are going to be aligned with values. Now, these identities, as I mentioned, these aren't your only options. And these are just mere examples of how some people are able to use their experiences to find some level of purpose to process what's happened. And this is in itself a process. It's not something that just happens, where after a conversation, you can identify exactly who you are, how things changed, and what your purpose is moving forward. That's not how it works. After cancer, your experiences may continue to change. Your relationships with others may shift as you move forward, which can further shape perspective, can further realign priorities. And what you find meaningful or where you find purpose may change and evolve through that. But being thoughtful, open, and curious, non-judgmental in the feelings that come up, extending yourself some of that self-compassion, can help you explore what this has meant to you, what it's meant to you going through the process, and then what it means to you now, especially as you're re-engaging with your life. Now, I'm hoping that some of what we discussed today has been able to resonate with some of you, and that there are some topics that you maybe felt mapped onto some of your experiences, realizing that many of them didn't. And even if you didn't find anything that mapped on or really strongly resonated, I hope this showed some level of a process that one might engage in to find ways to form their identity, to ways to use the experiences that you've had to form your identity and to eventually find purpose after cancer. And so as you move through this process, as you talk with your loved ones, as you maybe journal or ponder about this on your own, there's a few questions that I think you can ask yourself. Who was I before cancer? What are the values that were important to me? And what changed? What changed about me? What changed about my values? How can I be flexible to still live a value-based life? This is where that self-compassion and working towards some level of acceptance so you can build upon your experiences and what's happened to hopefully answer that question, who are you now? Are you a survivor, a person with cancer? Are you a patient, a victim? Or are you just you, but with new priorities? Or maybe you're trying to move on and get past these experiences and leave them behind you. The exploration can be helpful in figuring out where you're going to go next. Now, regardless of who you are, you can't go back. A lot of things have happened to us in our lives, good things, bad things, and all of these experiences shaped our identity. Surviving cancer can be a source of pride. It can be motivation for advocacy. It can be a reminder of what you're living for. But it's also a terrible illness and one that many would like to forget and move on from. But you can work to decide how cancer fits into your life, how it does or doesn't define you, what it means to you and those around you. So we can't go back in time. We can move forward. The things that happened to us have already happened to us. We're different now than we were before inherently. But you can move forward. You can look back and you can examine who you were, what's changed, who you are now, and integrate those values and experiences to shape your identity. You can find purpose this way. And with that, you can maybe move to a place, not where you were, but where you want to be, or maybe a place where you feel like you need to be. I know that resources are sometimes hard to come by. And with some of these topics that we talked about today, these are things that are often talked about in cancer or health psychology services. If that's something that you're interested in, you can certainly contact your local cancer center and find someone to talk with. These are conversations you can have on your own or with your family or friends. And as I mentioned in the beginning, this isn't a pitch to try to have people go to therapy, but just a prompt for conversation and I think exploration. But for those of you who like resources, I always say, contacting your PCP, asking for referrals, always a decent way to go. For some of these topics in identity making, it is really nice to be able to talk to somebody with a specialty in cancer or psycho-oncology. But looking at values and trying to figure out who you are in that way doesn't require that kind of expertise, doesn't need it. So depending on where you are and what resources you have, there might be other ways to get some of that. Certainly Gilda's Club is a fantastic resource. They have plenty of programming and the ability to provide a lot of services to a lot of people. And for what they don't have, they also usually know where you can find it. And so that's another really great place to look. So I apologize for ending on my 80s cliche, but there's a lot of really great wisdom to be found in 80s movies. So. thank you all for the time. I hope, as I mentioned, that people found this at least mildly thought-provoking. But I'm happy to take any questions if anybody has any.